to open it up, and I'm thankfully Ashton gave me a written copy this afternoon when I had my computer in there to get it fixed, and I promise I didn't touch it after I left it. But it's time to open up the December 22nd meeting of the Williamson County Health
I apologize.
Department.
With Commissioner Little, we have quorum, but we'll only have 3 voting members. Commissioner Lawrence was supposed to join us, and he might here in a moment. But otherwise, I believe we could go ahead and get started if everybody's okay with that.
Okay. Since we are operating remotely electronically, I'm going to ask Mr. Cook to read us the notice that's required for us to do it electronically.
This meeting is being held pursuant to Executive Order 65 issued by the Governor of the State of Tennessee. If there is no objection from the members, let the minutes reflect that the Public Health Committee members find it necessary that the meeting be held electronically to protect the health, safety, and welfare of the public due to the COVID-19 pandemic. Hearing no objection, we'll proceed accordingly. Chairman will read roll call. When he reads your roll call and calls your name, please acknowledge by stating your name.
We will read roll call. Brian Bethard.
Bethard here.
Bert Chalfant.
Here.
Tommy Little.
Here.
Commissioner Little is here, and Jerry Rainey, I'm here. So that gives us 4. That means we have a quorum, and we can discuss the resolutions before us tonight. Any questions or procedural things I need to know, Bobby or Jeff, before we get going here?
Just that every vote's got to be by roll call, and before making a comment, motion, or second, please state your name.
Oh, to redo the roll call. Okay. Brian, would you state your name and that you're here?
No, we're okay with the roll call. This is for the votes, for the resolutions when we get there.
Oh, okay. Well, the resolution that I'm holding is first is the new fee schedule recommended and requested by the Animal Center Director.
Bethard, move for approval.
All right, we have approval by whom?
Bethard, move for approval. Okay, we have an approval by Brian. We have a second? I think you're muted.
No, I'm not muted right now. I don't know what's wrong.
No, I think only Chalfant second.
Okay, Bert Chalfant second. Okay. With the resolution's been made and seconded by Brian Bethard and seconded by Bert Chalfant.
Hey, Jerry. Hey, Jerry, this is Rogers. Why don't you let Andrea explain what we're doing here? She's on the line, too.
Oh, good. Thank you, Andrea. Would you please?
Yes, I'm happy to explain. So most of these fees are going to stay the same. The fees that I sent out a separate spreadsheet that showed the fees that were changing. The only fee that's really changing is we're going up on the fee to euthanize an animal. So people bring their animals sometimes to be euthanized at the shelter, and we're going from a fee of $25 to $50. The reason for that fee change is just because honestly, it costs us more than $25 to euthanize an animal. And it was considering that most veterinary clinics charge upwards of $200, it's still quite a discount for folks. And then the really new thing in this resolution would be, as you know, when we get to the new center, the Shelter Planners of America did an assessment of our operations, and they really had 3 strong recommendations for us. And one of those recommendations was that we needed to more aggressively spay and neuter animals in our community. Their building projection is, projected for the number of animals that we would house if we do aggressively spay and neuter. So we want to provide an option for low-cost spay neuter for animals in the county to offset that number that we would need to take in. You'll see on the resolution that there is an option for people to always get their cats spayed and neutered for free, no charge. We currently do that. It's grant funded. We'll continue to have third-party funding for that. But there's also an option now that we'll implement when in the new year for people to actually pay a reduced fee based on income qualification. We've also done this in the past, but it's always been dependent on a grant from the state of Tennessee, and that grant has gotten to be so small that it really doesn't, it's pretty much ineffective. Last year it was $1,500, which you can imagine didn't really amount to much. So I looked at some other shelter models and found another shelter that is fully funding their spay neuter program by offering the service at a more retail price to out of county residents. Our plan is to offer a limited number of spots for out of county residents to come and pay for a spay neuter, and that cost, which will offset the cost of offering this service free or very reduced for in-county residents. So it'll create a benefit for county residents that will be primarily funded by out-of-county residents who take advantage of the program.
Okay. Sounds good to me. Any other questions? Hearing none, shall we vote? Do we have to do it by roll call?
Yes.
Okay, I will call the roll. And first, Brian Bethard.
Bethard, aye.
Aye. Bethard. Bert Chalfant.
Chalfant, yes.
Okay. And Tommy Little.
Tommy does not take a vote on this, but we do have Greg Lawrence now.
So Jerry Rainey, I will vote yes.
And you have Greg Lawrence online.
Oh, Greg. Welcome, Greg.
Commissioner Lawrence, yes.
All right, Mr. Lawrence, yes. So it's unanimous, 4-0 in favor of this resolution. Thank you, Ms. Johnson.
Thank you.
Okay, moving along then, let's look at the next resolution. I'm looking at the resolution appropriating and amending the 2020 to 21 budget by $26,864.01 for cost of the approval of one additional registered nurse position. These revenues come from unappropriated county general fund balance. And I'm
Bethard, move for approval.
Okay, move for approval. Do I have
Lawrence, yeah.
Lawrence moved for approval? Do I have a second?
Chalfant, second.
Okay, good. All right. Anybody want to speak to this one?
Thanks, Commissioner. This is Kathy Montgomery. Just letting the group know that we currently have 6 RN positions here in our Franklin Clinic and 1 LPN position. Our LPN actually facilitates our WIC program, especially when we have in-service WIC, or in-house WIC, I should say. Lately, since COVID, we've been doing online WIC and been able to utilize that nurse out at the COVID testing site and soon to be our vaccination site. As the fastest growing county in the state, we are starting to see and have seen certainly numerous people from our community, and because our community does not have borders, we see a lot of patients also from Rutherford, Dixon, surrounding counties as well that come over for their services. Right now, only 1 of our 6 nurses is actually a county position. The other, we have 3 of those nurses that are actually paid by the state. And then 2 of those positions are on a contract, a cost reimbursement contract. So certainly with upcoming COVID vaccinations and so forth that we're going to be having to dispense, as well as the numbers of programs and services, the expectation is that we're still going to maintain, our same level of care and primary and general care services that we provide here at the health department, in addition to vaccinations. So that's one of the reasons why, and I can tell you, I've been in this position 8 years. We've never come to the commission before and asked for assistance, but we really need some help right now.
We understand. Any questions? Well, it sounds reasonable to me, but any other observations or questions? Hearing none, I ask for a vote, and beginning with Commissioner Brian Bethard.
Bethard, yes.
Bethard, I always do that wrong, Brian. My apologies. I had a friend growing up that pronounced it the other way. Bethard, yes. Chalfant?
Chalfant, yes.
Okay. Greg Lawrence?
Lawrence, yes.
Okay, and Jerry Rainey votes yes, so it's unanimous, 4 yes, 0 no. Thank you very much. We'll move on to the next resolution that I see here. That was it's a resolution also from Animal Control, appropriating an amendment the budget by $10,000, revenues to come from donations from Friends of Animal Control. This, who wants to speak to this one?
Need a motion to get it on the table.
Approval.
Need a motion
Lawrence.
on the table.
Approval.
Okay, we've got a motion for approval by whom? Who was that said approval?
Well, this is Chalfant. I'll approve it just to get it going.
Okay, all right. Now that we've got it, we've got the resolution approved and seconded. Any questions, comments, observations? Anybody want to speak about this $10,000 extra donation?
I can just tell you that it's directly related to spay neuter. So the donation is designated to pay for an extra veterinarian, which we pay relief veterinarians $500 a day. So this is enough money to hire a veterinarian for 20 more days of spay neuter.
Okay, makes sense to me. 20 days to be covered. Any questions about this or observations? Hearing none, let's go for a vote with it. We'll call the roll for the commissioners that are present. Brian Bethard, Commissioner Bethard.
Commissioner Bethard, yes.
Okay, and Commissioner Chalfant.
Commissioner Chalfant, yes.
Okay, Commissioner Lawrence.
Lawrence, yes.
And Commissioner Rainey also yes. So our results are 4 yes and 0 no. Motion approved. Okay, the last one that I have is the resolution of the Williamson County Board of Commissioners opposing the state legislation. This was, I don't know if you've read this or not, but it's a resolution of the Williamson County Board of Commissioners opposing proposed state legislation to modify healthcare facilities certificate of need requirements and to oppose allowing the Health Services and Development Agency to expire. The Health Services and Development Agency to expire. This one was sponsored by Matt Williams, County Commissioner, District 9. Who wants to speak to this one?
Need to get it on the table.
Bethard, move for approval.
Okay. Mr. Commissioner Bethard, we have a approval. We hear a second?
Chalfant, second.
Okay, motion's been made and seconded. Any questions, speak up quickly. Otherwise, I would need somebody to speak to explain this for us a little bit better, if you would.
Hey, Jerry,
Speak to this.
this is Rogers. Let's let Jeff Mosley talk to this. He drafted this up for me, kind of give you the history on it. I know Matt Williams is on here, and he's supportive of it, but let's let Jeff give the history and how we got to this point.
Sounds good. Yeah.
The Health Services and Development Agency is a state department that oversees the certificates of need for healthcare facilities. In order to build certain hospitals, clinics, outpatient centers, you have to have a certificate of need. You have to show that the public or the community needs that before you can build it. And the Health Services and Development Agency is the one that implements and oversees that process. And that's been the way it's been in Tennessee for decades and decades. It is approved, that agency is approved or authorized every 10 years, and its authorization will run up in 2021. It will be their 10 years. If it is not renewed, it will go into sunset, which means in 2022, there will be no more Health Services and Development Agency. There would be no more certificate of need. In addition to that, the last year there was an effort in the legislature to change the population settings so that certificate of needs were not needed for ambulatory surgery centers, outpatient diagnostic centers, MRIs, PET scans, etc., several services on an outpatient basis. If you had population of over 175,000 on the Senate side, the House version was 100,000. They did not agree on the population basis, and so it ended up failing basically because they couldn't get their number together. But the underlying concept is one which would put Williamson Medical Center in jeopardy and at a deficit compared to other facilities, because we would fall into that population exception, meaning that anyone that wanted to put up an ASC, or which is now an ambulatory surgery center, an outpatient diagnostic center, or some of the other outpatient services included in the bill, would have been able to build anywhere in Williamson County and take the third-party payers, the insurance business, away from the hospital, which would have left the hospital without some of the revenue that it uses to provide community services that are not profitable, but that we have to provide either by federal or state law. So the idea was that we needed to make sure the CON stayed in place, and people should be able to show that there's a need for that resource before it's built. Now, this really came to a head in last year as Vanderbilt and St. Thomas sought certificate of need just over the Rutherford County border for a mini hospital, and then another hospital that Vanderbilt proposed, approximately 50-bed hospital. Those were 18 miles away from Williamson Medical Center, and were providing services that we've been trying to get into this county for a number of years, and we opposed those CONs, but we're successful at the Health Services and Development Agency in opposing the CON for Vanderbilt. St. Thomas got their mini hospital CON approved. So it just pointed to the need to continue the CON process and the agency to oversee it. And so Mayor Anderson has put together a series of conference calls with other mayors in the state to discuss this and try to come up with a strategy. And we felt it would be beneficial for our representatives and senator and the governor to know where Williamson County stood on the issue. It's not a sexy issue. It's not a high profile issue like some of the other things that you read about, but it's a very important one to the hospital. So that's where we stand with this right now. Matt, I'm sure you've got some things to add. That was really a 30,000-foot view.
Thanks. Can everybody hear me?
Yes.
Yes.
Yeah, and I think just to relate it back to the county commission, as Jeff mentioned, without the CON, basically becomes a free-for-all for any outpatient ASC clinic to move into the community. And some of those are profitable lines for the hospital, that if they're stripped of those, then the unprofitable and the indigent care that the hospital is required to do by law can all of a sudden become a pretty substantial liability. I mean, we do a couple of $1 million in indigent care that we don't get refunded for. There are some rural hospitals out there that do a much larger number than what we have. And so some of these laws and letting it sunset is even a bigger threat to them. And then, with the hospital ultimately is backed by the county commission, it can have a very real financial effect back onto us and ultimately our taxpayers. So the CON is a good thing for our community and our hospital.
Thank you, Commissioner Williams. Do we have any questions? Rogers, any further observations?
No, Terry, I don't. Jeff did really a good job at 40,000 feet.
Great summary. So hearing no questions, let's vote in favor of this. Let's call the roll. Commissioner Bethard?
Bethard, yes.
Bethard, yes. Chalfant?
Chalfant, yes.
Yes. Mr. Lawrence?
Lawrence, no.
Commissioner Rainey is a yes. It passes 3 yes and 1 no. Are there other issues to come before this group tonight? If not, do I hear a motion to end this meeting?
So moved.
So moved. Anybody gonna second that one for me?
I don't think you need a second to adjourn, but I'll second it.
Thank you, everybody. I'm sorry I was late. I had trouble. Talk to you soon. Merry Christmas.
Merry Christmas,
Merry Christmas.
everybody.
Chris.